Okay, now what we're going to do is listen to your heart sounds, your aortic, pulmonic, mitral, tricuspid, precordial. I'm going to listen to your carotid artery, okay, you can go ahead and lay down for me. We're going to listen to your heart sounds again. Okay, we're going to start with the aortic, the pulmonic, the mitral, tricuspid, and the precordial. Okay, can you lift your shirt up for me? Now I'm going to check for symmetry and contour. Okay. Now I'm going to inspect your umbilicus, the redness or inflammation. I'm going to inspect for pulsations. Okay. Now I'm going to listen to your bowel sounds in all 4 quadrants. Okay, now I'm going to listen to your vascular sounds, your aorta, your left renal artery, your right renal artery, your left iliac artery, your right iliac artery, your left femoral artery, your right femoral artery. Okay, now we're going to move on to, you can go ahead and get your shirt down. We're going to move on to your pulses. I'm sorry. First, we're going to palpate your liver. This is your spleen. Sorry, palpating your spleen. Palpate your liver, kidneys, okay, now we're going to check your pulses. First, we're going to check your popliteal. And your femoral. Your posterior tibial, your dorsalis pedis. Okay, and look at symmetry. Can you move your ankles around? Okay, hair distribution is even. Okay, I need you to perform the shin to heel test. Okay, now I need you to sit on the chair and we're going to do a patellar test. Okay, ready? Okay, if you can stand up for me, go ahead and turn sideways. I'm going to check your spine. Bend over for me. Okay, that concludes our exam. Thank you so much. Okay, for documentation, I would state that the patient was alert and oriented times 3. The patient was, he stated his age. He was of a small frame, a little underweight. His skin was clean and smooth. His hands, his turgor was less than 3. His capillary refill was less than 3. His peripheral pulses were present. His hair was clean. There was no dandruff present on the scalp. His cranium had no lumps or depressions. His cranial nerve 7, which is facial, was intact, normal, smooth movements. His temporal artery had no tenderness. His cranial nerve 5 had smooth movements with no limitations or tenderness. His maxillary sinuses and frontal sinuses had no tenderness noted. His symmetry on his neck, there were no lumps present. The lymph nodes, there were no lumps present in all of the lymph nodes. His range of motion was adequate for his cranial nerve 11. His spinal accessory, he was able to do with no problems. On his eyes, his sclerosis were white. His irises are hazel. His eyeball was moist and glossy. His pupil reaction was adequate. His cranial nerve 3 oculomotor was intact. His cranial nerve 4 trochlear was intact, and his cranial nerve 6 abducens was intact. For his ears, there was no discharge. They were clean, and there was no tenderness noted. For his cranial nerve 8 acoustic, he did pass the whisper test. For his external nose, there was symmetry. It was midline. His patency were no obstructions noted. For his mucosa, it was moist. And his septum, there was no deviated septum noted. On his lips, they were no cracks, no lesions. They were pink and moist. His buccal mucosa was pink and moist. On his teeth and gums, they were straight and white, and his gums were moist and pink. For his tongue, it was pink and meaty, and his palate was clean and pink. His tonsils, there was no enlargement noted on his tonsils. For his cranial nerve 9, which is his glossopharyngeal, that was intact. And his cranial nerves 12, hypoglossal, was intact. For his thyroid, there was no enlargement noted, no tenderness. For his inspection of his thorax and lungs, it was symmetrical. There was no tenderness noted. His percussion over lung fields was there was resonance. For his breath sound, there was no adventitious sounds noted. On his heart sounds, they were smooth, brisk, and bilateral. The aortic, the pulmonic, the mitral, the tricuspid, and the precordium. For his abdomen, his contour was flat. There were no brutes. Excuse me. His contour was flat. His umbilicus had no inflammation. His pulsation wasn't seen. For his bowel sounds, all 4 quadrants were present. His vascular sounds were no brutes noted. His aortic, his renal artery, his iliac artery, and his femoral artery. On his palpations of the liver, spleen, and kidneys, there was no tenderness noted. For his lower extremities, the skin characteristics were no lesions. His skin there was no redness. His hair distribution was even. For his femoral, popliteal, posterior tibial, and dorsalis pedis, all pulses were strong. His range of motion and muscle strength was adequate. His heel to shin test was adequate, and his patellar reflexes were intact, and his scoliosis screening had no signs of scoliosis. And that's it. Thank you.